of having children, and thinking about their growth and their their career. So when we think of that, we always think of short term goal and long term goal. So what is a short and long term goal for children? Not only children but for ourselves. So I mean, obviously in short term we want our children to be healthy, we want them to be doing well in school, and succeed, of course. And in long term we want them not to have any diseases, to have good immunity, no blood pressure, no diabetes, and of course, we all want healthy aging for all of us, right? That's our long and short term goal, by and large, right? So basically, health comes first, right? Health is wealth, as we all are stuck at home because our health is at stake. So if we don't have good health, nothing else matters really. So literally our goal is to have lifelong health, right? Why first 1,000 days critical? We need to kind of understand, why is it critical? Why those 1,000 days? You know, so first 1,000 days is basically conception to second birthday of the child, and it offers the opportunity to build healthier and more prosperous future, as good nutrition during this phase gives building block for brain and physical development. Okay, so what is happening during this 1,000 days is baby's brain has been developed. Okay, not only baby's brain is being developed, but basically there is a full physical growth. Can you imagine, from literally from small little ovum, from sperm, and that ovum you're having, and birth weight is about 3 kg, and by the time child is about 2 years of age, almost 12 kg, 12 and a half kg, right? So you have tremendous growth in this first 1,000 days, and not only physical growth but brain. I mean, brain is the most important part of our body, right? So it's very important that we take care of this 1,000 days. Okay, if you want a brainy child, and if you want a really healthy, robust child, and if you look at the growth, brain grows to about 80% of adult size, okay, by age 3, and it reaches 90% by age 5. So by the time child goes to school, say around 4.5, 5 years of age, 90% of brain development has already taken place. So you can imagine that mother needs to know so much, right? Not only when she's pregnant, but even before she is pregnant, she needs to know what I need to do so that my child will be tall and intelligent, right? And what are the right nutrients that she needs? Okay, and those are very important, because and those are needed at the right time, because child's brain is developing so fast, and at every stage child requires different micronutrients. So it is important, and we'll talk about it, what is required. Okay, so the right nutrition during this period, it means the difference between a life of productivity or struggle and between life and death. I mean, we work in tribal areas, we work in slums, and most of the time you will see that SAM children, you must be knowing SAM, severe acute malnourished children, those are mainly under 1 year of age, under 2 years of age, mainly under 1 year of age, and even predominantly they are less than 6 months of age. So if you don't have proper nutrition during first 1,000 days, that's basically that's you're taking away life from that child, literally. Okay, and at that child, if suppose child is survived, and if child grows up, but the body is so stunted, and with that body the child's brain is stunted, so basically that child will struggle for the whole life to survive. Okay, just not life and death in the beginning, but if child survives, basically they will have a child will have a very poor productivity, not only in school, but even when he grows up. So it's important that we think of not only surviving the child but also giving him good life. So what does it decide? It decides how healthy the child will be. So less infection, better immunity, reduced risk of chronic condition like diabetes and blood pressure. How brainy the child will be. What do you mean by brainy? So brainy means you have good cognition, means intelligence, your memory. So child has a sharp memory. We all want, right? Like, believe me, all your mothers must be asking you, what grades did you get? how many marks did you get? Did you come first? Did you come second? And for that, for everything to learn, not only you need intelligence, but what else do you need? You need memory, right? So this is important, that why some children in a class, they remember everything, and some children, they just don't remember anything. So that's important, to have a good memory. Concentration. If you can't concentrate, that means you will not be able to do well, so it's very important that child have a good concentration. Judgment, we all know what is judgment, whether something a child is doing, taking decision, whether it's taking good judgmental call. Those are very important. Mood is important. Sometimes you find the children are very moody, they're upset, they're all the time irritable. So your mood also depends upon how child was brought up in the first 1,000 days. Okay. And then lastly, your skeletal growth, how tall the child will be. So these are the three important aspects that we need to take care of when child is growing in first 1,000 days. So let's talk about brain. Brain is my favorite topic. So I'm going to talk about brain a little bit and see how we can make this child intelligent. Okay. So I'm sure you guys know about neural tube. This is basically a tube here. This is the picture. So this is your neural tube. Okay. So at around 3 weeks of age, your body starts developing in the form of neural tube. So this is a tube. Okay. Now here, this part is basically is going to develop into brain, and this part is going to develop into your spinal cord. Okay. So here, then what happens during this time? Suppose if you don't have enough nutrients which are required for this neural growth, you will have problems. So what are the micronutrients which are required for development of this neural tube? One is your folic acid. I think everybody knows about folic acid. But what we don't know, there are 2-3 other micronutrients which are required for a neural tube neural tube development. One is your vitamin B12, and second is your choline. So you require just choline, your vitamin B12 and folic acid. So we only talk about folic acid, but how about B12 and your, I know that a lot of you are nutritionists, and we know that B12 is hardly available in any vegetarian food. So what are you going to tell mother who is not even having milk? Like, for example, a lot of these tribal mothers, they don't drink milk. They don't have access to milk. So how will she get B12? Right? So we have to think of what nutrients that or what all food that you can give them. So they'll have initially, this is 3 weeks, so she doesn't even know that she's pregnant, right? So you need to start this nutrients not when she's pregnant, but when she gets married, or when she's planning a child. That's when you need to start food which is high in all these nutrients. I'll talk about choline later. And when you don't have this most 3 important micronutrients for neural tube, what will happen? This tube will not develop well. So do you see these tubes? These are not, basically you will see the gap in there. Okay, so this is all the gap, and this is called neural tube defect. This is a tube, neural tube. This is a neural tube defects. Okay, so then what happens when you have a neural tube defect, say posteriorly, like towards the lower part, right? Then you will have a little bit of spinal cord coming out. Okay, because the spinal canal is not developed well, right? So then what happens that basically you will see some amount of spinal cord here. Now many times what happens, you may not have such a big bump over here, but you may just have a little bit of hole, tiny hole over here. Okay, so what as pediatrician we have to do, we always have to examine when the baby is born, if the child has little hole, and if child has a hole, that means it's called basically spina bifida, and we have to get the MRI done. And that particular hole, if it is worse, then child has paralysis for the whole life. Okay, they have problem with the urination. They have to go through surgery. So imagine folic acid and choline and B12 is so important. Okay, and if child has hole in the front part, right where the brain is, then this is called an encephaly. Okay, we nowadays we don't see it much, but they do have when they're born. Obviously, they don't survive. So this are all basically totally, you can prevent all this condition, and that's why folic acid is been done compulsory. Okay, now this is basically anatomy of brain. Now I'm going to go a little bit in detail that what happens in child's brain when the brain is developing. Okay, so these are all basically different parts of your brain. This is the frontal cortex, frontal part, front of your brain. This is the back part, Okay, this is your side part, parietal. This is your occipital lobe, temporal lobe. This all different kind of lobes, right? This is a cross section. This is cross section, right? This is a front part. This is a back part. So if you look at it over here, so this is again, your prefrontal cortex, right? Your primary motor cortex. These are all the different parts of your brain. Okay. Now, if you look at the function of brain, so here is your front part of your brain. Okay, so do you see over here? This is this particular frontal part. It is involved in motivation and executive function. Motivation. If you don't have motivation to do anything, you can't succeed, right? So it's very important that this part of brain is developed well, because it functions for execution and for motivation. Okay, now a little bit about the anterior cingulate cortex over here, this part over here, that is involved in your social interaction, affection, attention. So look at this part is also so important, because that will help with the attention, right? Do you see over this red part over here? It's called amygdala. Amygdala is important for stress and for learning. So a lot of time what happens is, lots of children, they get a lot of anxiety, stress, or they have learning problem. That is because of problem with amygdala. And this is your hippocampus. Hippocampus, remember, is for learning and memory. If you want good memory, you make sure that anything which is required to develop this hippocampus, you work on that, and child will have good memory. Okay, so this are your basically brain development. So at fourth week of pregnancy, the brain has about 10,000 cells. Okay, and by 24th week, it contains about 10 billion. So you can imagine, in just matter of 20 weeks, look at the number of cells being developed, right? So nutrition is absolutely important, but there are so many other things which are important. Okay, this is your neurons. Do you see all these neurons? These are basically connection. So as brain is developing, neuron cells are developing, and do you see there's this layer of myelin sheet? This is called myelin sheet. Now myelin sheet is your fat. It's made up of fat. So when you have a good myelin, strong myelin sheet, what happens? The message passing through is very fast. The message, the signal, neural signals, those are very rapid signals, right? So you want to make sure that when mother is pregnant, that she gets good amount of fat. Okay, because baby's brain is made up of fat. This are all basically, it's all fatty sheet. Right? And most important, cholesterol is important. Saturated fat is really important. This is your, what is this? Neurotransmitters. Remember your synapses. These are synaptic junctions, and there are your neurotransmitters. So neurotransmitters are also really, really important, basically to pass on the signal, right? So you want to make sure that you have to learn that which are these nutrients which are important for formation of neurotransmitter. One of the neurotransmitters is acetylcholine. If you remember acetylcholine, now choline, remember choline I spoke about? So we need to know how do this mother get choline, so that a baby gets beautiful amount of neurotransmitters. Okay. Now this is another beautiful graph. What we have shown over here. This is basically from conception, from 9 months to birth. Okay, this is your first 2 years of life. So from this are first 1,000 days. In this green box is first 1,000 days. Then here is your child growing up, becoming adult, and this is your 70 years. So that's your basically your lifespan, right? So if here at around say 8 months of age, after 1 month of pregnancy, your child develop neurulation. Here that means that child is developing neural tube. Okay, once a neural tube is developed, here for next few months, it causes cell migration. Means different parts of the brain are being formed: frontal lobe, occipital lobe, right? And then just before 2 months of birth, child start developing myelination. Myelination means you saw those neurons, right? So it start developing that myelin sheet around those neural cells. So if you look at around 0 month at birth, some of the myelination has already started. Do you see all this? There are some amount of myelination already started, but then it starts picking up. So if you look at birth over here, the green color graph over here, so that is mainly your. So when the baby is born, what does baby do? Right? Baby can see, baby can hear, right? So those parts of your brain is getting myelinated. You're seeing, hearing. So visual cortex is for seeing, and auditory cortex is for hearing. Okay, so those parts of your brain start getting myelination, right? Then if you look at your orange graph, this peaks at around 8 to 9 months of age. Do you see around 9 months of age? So what happens at 9 months of age? Do you remember what happens in the child? They start developing language. So they'll start speaking a word or two. So there is a receptive language. They can understand what you're saying. Okay. And they can also start producing speech. They'll say mama, dada, they'll say a word. So to around 9 months of age, that area get myelinated. These are the areas of brain. Okay. And this one, the last line, the red line, that is yet around 12 months to 1 year of age, and that is your higher cognition. So by 1 year of age, 2 years of age, children have good amount of higher cognition function. They can understand what you're saying, they can respond, they become extremely smart. So do you see what this is the most important part? And after 2 years of age, you can see myelination going down. But it is very important that child continues to have good nutrition. Otherwise, what will happen, if we get myelination problem, we will have a cognition issue. Means we will forget, we will have a forgetting, our memory will get worse. So it's important that we take care of our myelination. Okay, so this two as you could see, 1,000 days are extremely important for brain development. Okay, now what are the other external factors which affects? As I told you, nutrition is good, but because there's a lot of these neural cells are developing, you want to make sure that there is reduction of toxic stress in mothers. Okay, so tomorrow, if you're planning to become when you get married and plan to become pregnant, you make sure that you don't have stress, you don't have any inflammation in the body. So you want to make sure that you don't have any diseases. Okay, and of course presence of strong social support and secure attachment, very important. Okay, so just make sure those are physical health is absolutely important, but your mental health is also important, and provision of optimal nutrition. Okay, now these are some of the nutrients which are required for brain development. Okay, so I'm going to go quickly because I'll come back to it, but mainly look at it. This is vitamin B6. What happens when you don't have vitamin B6? In fact, those are important for brain development function. Those are important for neurotransmitters. We talked about acetylcholine, but also your serotonin and so many other neurotransmitters. Okay, they norepinephrine, which also influences mood. And if you don't have B6, there are chances the child can have difficulty concentrating. Okay, then B12, as I talked about B12, right? Neural tube defect. Okay, then poor cognition. If child doesn't have B12 when baby is growing in the womb, they will have poor cognition. In younger children, in fact, what we find is children have tremors. Children can have lifelong neurological problem. So it's important that we always think of vitamin B12 because this is quite deficient in the vegan children. Okay, mothers who are vegan. Choline I spoke about. If you want your child to have a lifelong good memory and learning function, make sure the child gets mothers get enough choline. Okay, copper is important. Folate, we talked about. Folate is important. We also talked about iodine. I think iodine is important because iodine can prevent mental retardation. Long chain polyunsaturated fatty acids. So mainly I'm talking about DHA and EPA. Okay, ALA can get converted to DHA, which I'll come back later. But it's it's probably a 4% to maximum 10% get converted. So if mother is non-veg, please offer her fatty fish. Okay, that will really help child to become really. Look at this. If you don't have enough DHA, then there is poor attention, hyperactivity, problem learning, right? So DHA EPA is extremely important. Protein is important, selenium, zinc, right? Why zinc? Look at this. Remember hippocampus I talked about? Memory. You want your child to have good memory. Your zinc is really important. Okay. Vitamin K, we give it at birth. It's compulsory. We give it all over the world because children don't have enough vitamin K. So we give injection at birth. Okay, and iron is one topic that we can talk about for hours. Really, it's so important. It impacts myelination of nerves. Okay, and we have also found there are a lot of studies which says that children have, if they don't have enough iron, it does affect their mental health, so they have high level anxiety and depression later in life. So it's important that we take care of food which is high in iron. Okay, now this is some of the studies that I wanted to talk about. So one of the study is what is the influence of prenatal and postnatal growth on intellectual functioning, because we all want our children to be intelligent, right? So what they found, actually I love the study really. So what they found, that when child had beautiful linear growth, linear means tall, right? So when the child was growing quite tall in first year of age, before, not after, before 12 months of age, and weight. So this was the length part before 12, and the weight of the child before 4 months of age. If child was growing beautifully in first 4 months weight wise, and height up to 12 months of age, those children had a higher IQ at 9 years of age. Okay, so you can imagine, many times mothers said, oh, my child is not gaining weight, my child is not gaining weight. And if we don't do anything right away, then if you miss those first 3 months of weight gain, where children do grow tremendously, when you look at a WHO growth chart, and because they don't grow well, their height will also not grow well. Those are the children who will have poor IQ, right? So many times mothers said, oh, my child is not doing good in math, my child is not doing, because they must not have gained good amount of weight, not only during womb, not only during pregnancy, but also in first few months of life. So this is a really good study that we read all the time in pediatrics. Okay, and also another thing is your IOGR. So a lot of time, I mean, in India we see a lot of low birth weight babies, right? So here what they found, that children who were born small for gestational age, small for gestational age means for that term or preterm baby, that weight was not enough. Okay, for whatever gestational age baby was born. So here, if the baby was born, say at around 35 weeks of gestation, 35 week is basically a premature baby, or later, they scored lower score on your neurodevelopmental assessment. Means they did not do well neurodevelopmentally. Okay, so it is important that basically children grow very well in the womb during pregnancy. Okay, this is another very good study where there was a critical period of brain growth and cognitive function. So this is what they found is a brain growth during infancy, early childhood is more important than growth during fetal life in determining cognitive function. This means that even if child is born, say small, but if child has beautiful growth in first, say 12 months, 18 months, then that we can basically rescue the child. Okay, so even you go in the field and you see children are born to 2.3 kg, 2.4 kg, but you focus on the breastfeeding skill, you focus on the complementary feed, and children do beautifully. So this was another very good study which was done. Now, timing of growth faltering is very, very important, okay? Because what we found, this is one study which was done. They basically took 700,000 children, okay, from 0 to 6 years of age, and they took this data from 57 different countries. Look at this huge study, and very recent, 2018. Right, and what they found, that basically most linear growth faltering, linear growth means height, and the wasting, which is your acute malnutrition, it takes place prior to 23 months of age. Means most of your malnutrition, undernutrition takes place under in 1,000 days. Okay, so here is the growth. Here is a chart that they shown in their publication. So here, this is your boys. So these are your boys. Okay, this is your mean. 0 is mean. Most of the 50% children should be over here. Okay, but here, as you see, this is your 0 month, 6 months, 12 months, 18 months. Do you see how boys, and this is your height for height, okay, your height for age. So your Z score. So look at how children are going down in 18 months, right? These are boys and these are girls. So girls are not so small to begin with, but basically they fall, right? Boys fall definitely much more, and then by 60 months, they are pretty much equal, right? So girls have advantage in the beginning. Now, this is your weight for height. Means this is your SAM-MAM, your acute malnutrition, right? So here, this is your boys. This is your mean 0. Okay, so children overall in 57 different countries, children are not bad to begin with, but look at this, how badly they fall, right? And then they come up. So everything, whenever you see it, this growth faltering occurs in first 24 months, and generally wasting occurs much early on. That means children are not gaining weight. So in first year of age, look at this, in first year of age, children are not growing well, they are not putting on weight, and eventually they become stunted also, right? So what happens to all these children who are not growing well? They Poor nutrition will lead to stunting. They will become short. Okay, so if you're thinking that oh my God, this child is so short, and if you see them at 3 years of age, 4 years of age, the stunting is irreversible. So it's irreversible if you don't tackle it within 1 year. Okay, in my experience, if child came to me after 6 months of age, I could not do much about the stunting part, really. I had to bring those children up on a reversal of stunting. I could do it just if they came before 6 months of age. So that first 6 months is extremely important. Okay, as they were losing height, they were also losing IQ. Okay, so there is a loss of IQ, which is very, very detrimental to child's life, right? Then what happens, the stunting, when you are stunted, you will be stunted as an adult, right? And if you're a woman, and if you're only 5 feet tall, then you will be basically passing on the stunting. Stunted girl child at 2 will give birth to a low birth weight baby. So your risk of getting a low birth weight baby is very high. Okay, if you're stunted. Okay, so you basically you're passing on that. That I wouldn't call it gene, but epigenetic expression to the child. Okay, and then that stunted child has a very high risk of developing metabolic syndrome later on. Okay, so you don't want the child to develop blood pressure, diabetes, so then you work on them in first 1,000 days, and of course continue on, the children will not develop metabolic syndrome. Okay, and sometimes it takes about 2 to 3 generations to combat stunting. So if suppose child is stunted, mother is stunted, grandmother is stunted, so that girl child, it may take maybe 1 or 2 generations for the child to become 5'8", 5'9". I'm talking about a girl child. Okay, and we have a lot of cases now. The children are really, girls are very tall even in India. Okay, and but that takes 2-3 generations of good nutrition. Okay, so there is this journalist, Mr. Roger Thoreau. He was in India and he did a lot of study, on malnutrition. His beautiful paper, you guys must read it. And he wrote a beautiful. He quoted this. He wrote that if you want to improve the future, to truly improve the world, we have 1,000 days to do it, mother by mother, child by child. For what happens in those 1,000 days through pregnancy to second birthday, it determines to a large extent the course of child's life, her ability to grow, learn, work, succeed, and by extension, the long-term health, stability, and prosperity of society in which the child lives. Okay, so if you want to improve the world, you can't leave a single child and single mother. Okay, if you want a beautiful world where no child is malnourished, you have to basically go and help each and every mother who comes to your door. Okay, or you have to go to her door. Okay, now what are the nutrients essential in children? I'm going to go very quickly on this because without this I cannot finish my presentation. This is Professor Michael Golden. Okay, he's the guru of nutrition in children. Really, he worked in Africa for 50 years. He's from Scotland. Okay, and he's a biochemist, and then he's a pediatrician, and he has published about 100 200 papers on malnutrition. Okay, and then he worked first on he did a lot of experiment on rats, and then basically he came up with RUTF, ready to use therapeutic food. So it's because of him, he recognized what are these nutrients which are lacking in this malnourished children, and he developed this special food, which would bring the children out of malnutrition. Okay, so he basically recognized there are 2 different types of micronutrients. Okay, and if you know, I'm sure you guys know that we require about 40 types of nutrients in our body, right? I mean, not in the body, but we require in our food, essential nutrients. Okay, these are 40 types. Okay, this is probably new for you, but this is a concept that doctors are using right now to treat severe acute malnutrition. Okay, now this 40 types of nutrients are basically divided into type 1 and type 2 nutrients. Okay, so what are your type 1 nutrients? Those are functional nutrients. And type 2 are your growth nutrients. Growth nutrients, but it is involved in growth of the child. Functional nutrients, but they are basically, particularly used in particular functions. Okay. So when the child is deficient, say, let's talk about type 1 first. When the child is deficient in type 1 nutrient, these children, they grow pretty well in early age. Okay, so early stage, there is no problem if children are deficient in type 1 nutrients. Baby continue to grow. They can, and what happens is this type 1 nutrients are stored in the body. So, for example, one of the example of type 1 nutrient is your iron. So iron is stored in the body. So if suppose child is not getting iron on a day-to-day basis, but has a good storage in the liver, the child will continue to get iron, for metabolic functions. So this is important that most of the nutrient in type 1, not all, most of them have body store. So you may not require day-to-day in child's diet. Okay, when they are deficient, there are clinical deficiency signs and symptoms. Okay, so again, iron, if child is iron deficient, you will see clinical signs and clinical symptoms. Which are other nutrient which are type 1 is your vitamins, vitamin A, vitamin B, vitamin C, D, all of them have clinical signs if they're deficient, right? Another one is iodine. Okay, then it only affects specific enzymes. So suppose if one particular, just not all the metabolic functions, only some enzymatic reaction it helps, it affects. So basically, suppose child has anemia, or iron deficiency, only probably a child will be anemic. Nothing else. The other metabolic function is going on, right? What is the amount in breast milk if type 1 is deficient? Basically, mother's milk will be deficient too. So if mother is deficient on iron, the breast milk will be deficient in iron. So that's important. Now, type 2, we all know about type 1 very well. All of us, doctors, nutritionists, we all know iron, calcium, vitamin D, vitamin A. We all know about type functional nutrient. What we don't know much, and that's why we have so much of undernutrition, is type 2 nutrient. Okay, and what is the first response if child is type 2 nutrient deficiency in their diet? Is the growth failure. The child will stop growing. Child will not have muscle mass developing. Child will not grow tall. Child will not have all this. So the first response is child will stop growing. Why child stops growing? Because there is no body store. So do you see the body store? Absent. So this type 2 nutrients are not stored in the body. So child requires in the diet on a day-to-day basis. Every day child requires those type 2 nutrients. Okay. And if child doesn't get it, what's going to happen? This type 2 nutrients are part of our body. So our tissue, our muscles, our organs are made up of type 2 nutrients. Okay. And another thing is it is required in for general metabolism. So do you see effect? It is required for basically full metabolic, lot of biochemical reaction, right? As a coenzyme, as a cofactor, very, very important. So if you don't have those type of nutrients in a diet, it's not coming from store. So it will come from the muscle. Baby child will start eating up his own muscles to have this micronutrient because it is required for metabolism. If you don't have this micronutrients, metabolism will eventually stop. Child will get infected, child will die. Okay, so what nature does, nature doesn't take away life in a day or two. It slowly baby starts melting, and all those nutrients which are there in the muscle mass come in the blood. Okay, whatever is required by the body, they will keep it. All the other rest will be excreted in the urine. Okay, so this is very important. Here I've written that basically in breast milk, type 2 are stable because it's coming from mother's muscle mass. So it's important that this type 2 nutrients are required. Okay, even for mother, if mother is breastfeeding or if mother is pregnant. Okay, another thing I want to talk about is anthropometric. So it appears late in the deficiency. So your functional micronutrient, if they are deficient, you will see signs and symptoms. There are biochemical tests you can do. You can do iron test, you can do vitamin D test, right? But for growth type 2 nutrient, there are no specific tests because there you have to do tissue biopsy, which nobody does. Okay, another thing is only way you can diagnose if child is type 2 micronutrient deficient is by looking at anthropometric abnormality. So you look at your height, you look at your weight, you look at your MUOC test, and you will see that child is small, they are stunted, anorexia. So if child has type 2 deficiency, after certain age, what will happen, or after certain stage, the metabolic function will be so poor in these children that they will have anorexia. Means they will have, their appetite will go down. And this are called complicated SAM. Okay, and these children need to be in the hospital right away. But in type 1 deficiency, your child does not have loss of appetite. So appetite is perfect. Okay, so this I wanted to just show you what are type 1, type 2 nutrients. Okay, so if you look at type 1 nutrient, those are iron, iodine, copper, calcium. This are all your type 1. Okay, you have by and large storage. Type 2 is your essential amino acids, your potassium, magnesium, phosphorus, sulfur, zinc. All these things are type 2. We know about protein, we know about fat, but we don't know much about potassium, magnesium, phosphorus, sulfur, zinc. We don't know much. Sorry, we don't know which food gives magnesium. Maybe some little one or two thing, but we need to focus on type 2 to prevent malnutrition. So what is this? Is this type 1 or type 2? Look at the muscle mass. What's happening? Their muscle mass has been melted, right? Do you see? Look at this. Muscles are gone, completely gone. Child has such poor metabolism that look at this. Child is absolutely exhausted. Do you see it? Metabolism is absolutely poor. Child is so exhausted. Brain is not getting enough energy, right? Look at the tummy. Do you see in both of them? Do you see how tummy is big? What is happening? Because the motility of gut is so slow, because child is not getting enough energy, what is happening now to the intestine? There's decreased motility, and what will happen? There'll be something called SIBO, small intestinal bacterial overgrowth. There's a lot of bacterial overgrowth. So these children, we have to start with amoxicillin first. Okay. Here, see, look at this. All the muscle mass is gone, right? Because type 2 is not available in the diet. Child is just getting the type 2 nutrient from his muscle mass, right? How long these children will survive? Do we know how many children do we have in India like this? SAM children? How many children? 1 crore. We have 1 crore children who are like this in India presently. And now with COVID, I don't know what will be the number. I have no idea. Probably double, triple. I don't know. Because young children, it takes just maybe 5 weeks or 6 weeks to become like this. Okay. Because they don't have fat storage as much as adults. So they become deteriorated very fast, and they start gaining also very fast. So that's important to basically take care of nutrition for young children. Okay. Now that what we saw, I told you about this becomes, these children have this kind of problem within 6 weeks. You see this, but if these children survive, okay, and they survive and they become older, okay, but what will happen? Now their height will suffer because they haven't gotten those type 2 nutrients. These are same age children. Look at this. This is about 3.5-year-old child. This is 3.5-year-old, 3.5-year-old. Look at the difference between their height. Same thing. This is Guatemalan children. Okay, here 9-year-old children should be here. This is all 9-year-old kids. But look at their height. You see how their height? What has happened? Children have not gotten type 2 nutrients in the diet, and that's why their height has suffered. And all these children whose height have suffered, these children have not gotten type 2 nutrients when they were growing up in first 1,000 days. Okay, because first 1,000 days, that's when your height is growing really fast. And when height is not developed, what is not developed? The brain. So these children will not do well in the school too. Okay, protein. You guys know a lot about protein, important for everything. I don't want to go too much in detail because I know that we all learn about protein. One thing I want to show you, was a study which was published in a pediatric, US pediatric journal. And what they found, this is a white Caucasian baby, okay, and this is Indian baby, okay. What they did a body composition of and compared American baby versus Indian baby, and they found that Indian baby's average was about 2.7 kg, and white Caucasian babies about 3.5 kg. Okay, and now if you look at the body composition, this is your fat. Okay, now what should be more in human being, fat or protein or muscle? Obviously muscle, right? We want more muscle mass. We don't want too much fat, right? Look at white Caucasian baby muscle mass, 20% muscle mass, ours 10%. Their fat 10%, ours is fat 20%. Viscera means organs. Organs should be big, right? Viscera 20%, ours 10%. Do you see where we're going wrong? And we are small. Means fat doesn't have much weight. Muscle has weight, right? We don't have muscle. Now, when you at birth, when you have this kind of body composition, what happens? When this child grows up, what's going to happen now? These children are going to get metabolic syndrome because we don't have muscle mass. Lean mass is important, right? To prevent your to improve your insulin sensitivity, right? And that's why we have something called developmental origin of health and diseases. Very beautiful theory hypothesis you must learn. They have thousands of articles coming out, scientific articles, that what happens when you don't have a proper environment when the child is developing in the womb, and just postnatal development, when you don't have those good development, what happens to this all these babies when they grow up? They basically have problems like blood pressure, diabetes, insulin resistance, all that. Uh, and what are the critical window? Preconception, okay, fetal period, and early postnatal period. So important that you take care of this 3 period, and the children will not have metabolic syndrome. Okay, the food high in protein, we all know. Please remember your complete protein, incomplete protein. I always recommend complete protein if mother is non-veg. If she is vegetarian, I still try to kind of convince her to have at least eggs, much better quality, and it is very high in protein, your cholesterol, which is important for your myelination, important for brain. Cholesterol is really important for brain development for the child. Okay, and if she's not eating eggs, I would definitely recommend dairy products if you can manage. But another thing what we can do in rural area, tribal area, please go ahead and give them seeds. Okay, now a lot of these mothers, they grow pumpkin or they grow cucumber, they grow all this thing, but they don't eat those seeds. So it's important that we teach them how to make those, to dry it, to roast it, and they can just remove the covering and they can have seeds. Some of the vegetables are high in protein too, but not so much. They also have phytic acids, phytates. So, but spinach, cauliflower, some of them, nuts, legumes are good. Your peanuts are good. I really prefer beans. Beans are extremely good in protein, so I like to sprout them, cook them, and then have it probably with millets. I don't like too much of rice and wheat. We need to come out of this rice and wheat obsession, really. Okay, nuts are good. Now DHA and EPA, slowly and steadily, DHA and EPA absolutely important. Lacking in most of us. Most of us are not eating fatty fish, unfortunately. So extremely important for our brain. 90% of PUFA. So DHA is made up of 90% of PUFA in the brain. Okay, imagine. So your PUFA, what you're having right now, you're not having DHA as a PUFA. What we are having is soya oil, corn oil, canola oil, peanut oil. Those are all high in omega-6. Those are not high in DHA. Okay, so you want to make sure that if you want good PUFA in your brain, you better have DHA. Okay, all right. And look at this, how it matters. Basically, it is important for attention, planning, problem solving, inhibition. So I think if mother is non-veg, just go ahead and offer her seafood or fish. Okay, this is your neuron, right? These are the myelin sheet that I was talking about. Okay, myelin sheet, very important. It speeds up the connection. This is your cell membrane. Do you remember your cell, right? These are basically your lipid layers, right? Phospholipid. Okay, now this has to be absolutely fluid. Okay, it should not be very rigid. If you have a DHA, if you have EPA, if you have omega-3 food in your diet, this will remain fluid. It'll move, it will remain fluid. But if you have a diet which is high in omega-6, this so basically you will have a lot more omega-6 over here, and it will become more rigid. It will have a lot of inflammation. It will have a lot of breaking of the cell membrane. Okay, like it's important that the ratio is good, omega-3 to omega-6. Try to keep it 1:1. So if you're not even having omega-3, then avoid omega-6. Okay, so this is again your DHA. Why is it important? You guys know about all this. Look at this, of course, for brain. Okay, Okay, now what is the requirement of DHA? Basically, 250 to 500 milligram of both EPA DHA per day, minimum 200 milligram by pregnant and lactating mothers. Okay, and the optimal dietary ratio, I prefer 1:1. 2:1 is still too high for me, but 1:1 ratio is good. But our current diet is typically 10:1 is to 10:1 to sometime 25:1. And in Bengal, people have this habit of eating a lot of fried food, and that fried food is made up of all the soya oil and corn oil. So please avoid fried food. Tell mothers if she wants to fry, she can fry it in ghee. Okay. Okay. And here I mentioned about the conversion ALA to DHA, just almost up to 4%. Right now, I read one study, they said up to 10%, but I feel probably just not more than 4 to 5%. Okay, now here again, uptake of omega-3 by mothers, so what they found that if she took food which was high in omega-3, which is seafood, those children have higher verbal IQ. Okay, children, mothers who took less amount of omega-3 through food, those children had poor IQ. Okay, so that is important. Here are some of the studies which are done. What they found, that if mother took omega-3 medicine, okay, it did not appear to improve child's neurodevelopment. So a lot of time what happens, they said, oh, mother should take omega-3, or the mother should take tablet, but it did not really help at 5 years of age. Another thing is also a lot of this formula making company, they said, oh, we have made a formula which is omega-3, but that it did not help with the IQ of children. So it's all marketing gimmick. So mother's milk has most amount of DHA, EPA, extremely important. So please recommend mother's milk. That's why IQ is much higher. Okay, and for adult, they did find some difference in blood pressure and plasma triglyceride level, but on cognition they did not see much of a difference. Okay, so for adults, if they are taking, so some of the main thing is your fatty fish is important. Those are DHA, EPA. Okay. Choline, quickly I'm going through choline. Okay, important for formation of acetylcholine. So the neurotransmitters. Okay, remember I talked about those cell membrane. So for cell membrane, you need phosphatidylcholine. And this sphingomyelin is important for brain. So choline is really important for your brain formation. Okay, it is also methyl donor. So it's basically, it donates a methyl, right, and it converts homocysteine to methionine. Now homocysteine you don't want too much in your body, because it's very inflammatory. Okay, so choline is important basically to convert your homocysteine to methionine. Okay, and then there are other micronutrients which are important, your your folate and your vitamin B12 also. Okay, again important for all your mainly your brain, right? Okay. What happens when you don't have choline? Same thing. Look at this. Same thing. So don't forget your choline with your folic acid. Okay. Mainly comes from food. What is your RDA for choline? For us, 425. For men, 550. Are we getting enough? I don't think so. Pregnant mothers, lactating mothers, about 500. Okay. Now I'm sure a lot of nutritionists are there, and you know what is nutrigenomics, right? So dietary choline works as nutrigenomics. Okay, so it's important to have it in a diet. Okay, now this is this very beautiful study which was done by Mark Maneri. He's another guru of malnutrition, and what he found, he did basically studies of 62, many children, about 313 children, stunted children. And what he found, the children who were stunted, basically they were not receiving amino acids, choline, mainly choline, which was important for sphingolipids and glycerophospholipids. So the diagram that I showed, so if choline was absent, children were absent on this also, sphingomyelin and phosphatidylcholine and phosphatidylethanoamine. So that's why they said that it's important that children get not only essential amino acid, type 2 nutrients, and also the choline. Okay, so that's why I just wanted to put this choline picture. This is phosphatidylcholine. What it does, you can see, it basically helps with the lung function, gut, pretty much everything, right? Okay, what is the best source of choline? Look at all these nutrients which are present in your eggs. Look at this. right? How can you beat egg with anything? Excellent carotenoids, omega-3, AD, K, B6, B12, even folic acid, calcium, everything. Okay, type 1, type 2. Vitamin C, it's not there. We can just put some nimbu in it. Okay. Which are the other food which are high in choline? This are chicken liver, soya flour, salmon, chicken, turkey, mainly non-veg. Cauliflower, if you have half a cup, only 24 grams. So if you have a mother who needs 500 grams of milligrams of choline, how is she going to get it if she's vegetarian? Okay, think about it. And I think you should also do your dietary recall and see if you got choline or not, especially if you're planning to become pregnant. Okay, if you eradicate three most prevalent micronutrient, your world IQ will be increased by 10 points. Which are those? Iron, zinc, and iodine. Okay, two of them are type 1. This is type 2. Okay, iron, again, we know nature's iron is important. One thing I want to tell you about iron, that if iron is absent in children, say when they're growing in first year of life, especially after 4 months of age, the children have cognition, and they have impaired cognition, and that's permanent. So so once you diagnose child with anemia, that means a permanent damage has already been occurred. After that, if you give any iron, whatever damage is done is done. Okay, so main thing is your prevention. So please prevent children from getting anemia. In US, what we do is we check the children at around 9 months of age, and before we check them, we already start them on iron supplements. That's the protocol in India, I mean in US. Okay, but we don't want to give too much iron also in this children. Better to get it from food, because what happens is extra iron will affect it acts like a free radical, right? And then it can cause problem. It can also affect your gut microbiome. Okay, so it's important that we don't just indiscriminately keep giving iron without understanding. It is like a it's like a double-edged sword. Okay, so you don't want to do too much. These are food and iron. If child is non-veg, please give them liver. Very high amount of iron they'll get all the nutrients. If they are vegetarian, give them egg. Don't give them too much of milk, because milk dairy is very poor in iron. Okay, so I don't like it. I like the Choli is really good. So all your pulses are good. Okay, make sure that they get it with vitamin B, C, your C. Epigenetics, we know environment makes a difference. If child is born, and if child environment is good, eating right food, exercise, mother is exercising, they are playing well, eating diet, they will be healthy. Same child, if environment is poor, processed food, all this pizza, soda, smoking, exposure to smoke, mother is lazy, children are just basically not playing, so children are going to develop diabetes, blood pressure, right? So a lot of time we are told that, oh, my mother has blood pressure, that's why maybe I will get it. No, if mother has blood pressure, because probably her diet was not right. Okay, she became insulin resistant. But if your mother, father, everybody in the family have diabetes, but if you are healthy, if you're eating right kind of food, exercising, you will not get diabetes. Okay, very, very rare to have genetic. It's in right now, it's all lifestyle. Okay, and one thing you want to do for children is to basically make sure that they get mother's milk. Okay, and that is a full different topic. I don't want to go too much in detail. Okay, it's breast milk is like 5-day training. Okay, so I'm not going to too much in detail. I just want to show you these are the effects of breastfeeding. So in India, this are all India numbers. Okay, basically 56,000 deaths in children under 5 are because of babies not breastfeeding. Okay, look at the number of diarrhea episodes per year. Look at these episodes of pneumonia. You can do reduction just by giving mother's milk, right? And even mothers can be saved, because they have less breast cancer, obesity is better, right? So this all the what happens when all the babies are breastfed. Okay, 3.4 3.4 point increase in IQ across rich and poor. Okay, how many children are stunted in India? Okay, quiz. Anyone's guess? 38%. Okay, how many young children get minimum adequate diet? Means how many children get proper diet, number of times, frequency, adequacy, everything. Only 9%. It's a shame on us, really. Total shame. We don't know. We don't know what to say. Mothers don't know too, right? How many children who are rich, the highest wealth quintile, okay, those 5-6% who are the richest of the rich children who are malnourished? Anybody? Why? You think they don't have access to food? Then why are they stunted? Just think about it. Okay, now here are some of the growth charts I'm going to show. This here after before that growth chart, I want to show you nutrition indicators. Okay, these are the nutrition indicators for NFHS 4 data and NFHS 3 data. Okay, look at the infant mortality rate has gone down, but we need to decrease it more. How many children are breastfed within 1 hour? Only 42%. We need that higher number. Earlier you start, better it is for the immunity. Okay, how many children are exclusively breastfed? Only 52% children. Only 52, right? So we need to improve those numbers. How many? How many are stunted? Okay, this is rural area rule number. 41% children are stunted in rural area. In some of the rural areas that we work in, 80% children are stunted. 80%. Those children are prone for basically IQ is very, very poor. Okay. Okay, that these are some of the growth charts that we have seen in our clinic in urban slum of Mumbai. Okay, so this is growth charts of same child, weight by age, length by age. It's a WHO growth chart. This child came to us 3 months of age. Look at the weight. Now this is a WHO growth chart. So the green line is your 50th percentile. So 50% children should be on green line. Okay, the whole world uses this charts. Okay, and you get this child was really, really low. 3% children are below this last line, but in India, we have 38% children who are below this red line. Only 3% should be on this line or below line, but we have 38%. It's like really, we should be so proud of India. And here, as the weight started going up, you see this is the height. Do you see? So the height completely depends on the weight. So if weight gain is good, height gain will be good, right? So these are some of the growth charts. Most of our children are over here in India. We are trying to bring them above red line. Okay, that's our goal. We want to make them tall and lean. This is your weight child, and weight by age. This is length by age. Same, different child, but the same. This one is same child. Here, another child. This is weight by age chart, and this is length by age chart. Look at this child. He's going 97 percentile for length. 97 mean only 3% children in the whole wide world are above this line. So he is basically reaching the top in not only in India but in the world. And this is a slum child. So if the slum child can become tall, those richer children should definitely reach. So they have access to food, right? It's just we need to know what food to give them. So again, this is length, this is weight. Same child, as you can see, as the weight is growing, height is growing, right? And look at this child over here. 85th percentile means only 15% children in the world are at this tall, right? We have thousands of children we have monitored like this. So let's prevent malnutrition and diseases. Okay. One thing I wanted to kind of tell you that at IIT Bombay, we have created tutorials on 37 different topics. Okay. It's all on adolescent, maternal, pregnancy, lactation, breastfeeding, and complementary food. Lot of videos. They're animated videos. Can you please write it down? Health Spoken Tutorial IIT Bombay YouTube channel. Okay, so you can go and basically subscribe to it and keep the notification on. And also please write down this toll-free helpline number. This helpline will basically, we have my team will help in 6 different languages. If any mother, any nutritionist, any healthcare worker has any question on our topic, on lactation, nutrition, complementary food, we'll go ahead and answer those questions. Okay, if you're on Twitter, you can follow this handle, healthst_IITB. And if you are on Instagram, you can basically click on Health Spoken Tutorial, and you can basically follow us. We will put all the different And all these videos are skill based. It's skill based, and also there is a beautiful tutorial on type 1 type 2 nutrients. I did not talk much about type 1 type 2, but there's so much more to it which you can learn from this tutorial, and they are in multiple languages. Right now we have 15 languages, so not only you can learn, but you can show it to your healthcare workers, your mothers. They can learn from it how to breastfeed. Cross cradle technique is my favorite. Cross cradle hold, latching. So thank you. Okay. So I'm going to now go through all the questions and see if I can answer any of those. Okay. So I have Ms. Vidya Lakshmi. Thank you for joining me. Assistant Professor, Department of Food, Nutrition, Dietetics, Ooty. How beautiful. You're from such a beautiful part of India. Thank you so much for joining. Vaishali. Hi, Jayashri. Ali Hassan, Ekta. Any question, please go ahead and put it. I will go ahead and what are type 1 nutrients? Type 1 nutrients are mainly your vitamins, your some of the minerals, your calcium, iron, fluorine, copper, manganese, iodine. These are your type 1 nutrients. By and large, most of them have storage, but those are functional nutrients. All your vitamins, so vitamin A, B, C, D, E, K. Please mention the name of these two types of nutrients. I already mentioned. Type 1 are those what I mentioned. Type 2 is your essential amino acids, essential fatty acids, magnesium, sodium, chloride, potassium, zinc, sulfur. Sulfur is very important. I can talk about sulfur for 3 hours. It's my favorite. As a doctor, I think all the doctors should know about sulfur, because so many compounds in our body are made from sulfur, organosulfur compounds, especially for your joints, your skin, for your liver. For glutathione is important, so someday I'll come and talk about sulfur. Please mention the name of, okay, thank you. Okay. Okay, so I don't have many more questions now. If you have any question, please go ahead and ask. Okay, so I'm going to end now, and if you have any question, I'm going to just put my my email, so you can connect with me, and if you have any question here, that's my email. So okay, how about safflower ghana oil? How healthy it is? Hi Dipti, thank you for joining. The thing is, it is still a seed oil, right? Another thing is, there is this beautiful study which came out from Australia, where they basically heated lots of different oils, okay, including your canola oil, your safflower oil. And what they found is that lot of seed oil, they did release toxic aldehydes. Okay, so and the oil which had least amount of toxic aldehyde at a higher temperature were coconut oil, and olive oil. So those were the one. I prefer ghee, because ghee it's very stable fat. Saturated fat is a very stable fat, right? So it will not produce a lot of these toxic aldehydes. And with a lot of this omega-6 oils, what happens when you keep heating it, especially when you eat out, like for example, if you go to McDonald's and you're having those fries, fries are made of from probably all these omega-6 oils, so they refry and refry and refry, and that becomes your basically your hydrogenated oil becomes dalda eventually. So you don't want to, basically those become trans fat. So you don't want, like, generally I don't eat any fried food outside. Even at home, I prefer to roast it. I'm exclusively breastfeeding mother of 5-month-old baby. Should I take any iron tablet from outside? I prefer that you eat food which is high in iron. Really, to be frank, because when you're eating food which is high in iron, it just does not come with iron, it comes with a lot of other things in that food. That complexity is very important, right? So, and then of course you want to make sure that when you're eating that food, you just have vitamin C, you need it for absorption, but also have a non-veg food. If you're non-veg, your non-veg food are very high in iron, right? So go, even eggs are amazing source of iron. Bioavailability is so good. Liver is amazing. Okay, red meat, so ma'am, please talk about breastfeeding in COVID. So here, when you go on our website, not website, but on a YouTube channel, here, Health Spoken Tutorial, I'm going to just put it down. We have a beautiful tutorial on breastfeeding during COVID. So go ahead and just click on that YouTube channel, Health Spoken Tutorial, and you'll be able to see our video on that. Thank you, Shweta. Very informative session. Thank you. Okay, so if you have any other question, I can just wait for a couple of minutes, and but please feel free, and please pass on these videos, Health Spoken Tutorial, to all your friends, because they will learn a lot. Subscribe to it, and please go ahead and keep the notification on. In fact, today only we are coming up with recipes rich in magnesium. Okay, so you will see like what food that you can eat which are type 2 nutrient, right? So it's good not only for the children but even for us, because magnesium is important for our muscles, right? So if you have a lot of cramps, if you have headache, if you can't sleep well, a lot of this thing, your magnesium will help. Okay, all right. Thank you so much. I think I don't have too many. Ankita has one question. Why some mothers are not able to produce breast milk? Some major reason related to nutrition? That's a good question, Ankita. What happens is, so for breast milk, you require two hormones. Remember, prolactin and your oxytocin. Okay, so what we found in the study, there are a lot of studies are done, and when baby was given breast milk within 1 hour, okay, within half an hour, 30 minutes, 45 minutes, and when mother's breast got stimulated, those mothers had much higher output at 72 hours of age. Okay, so what you want to do is that you tell doctor that I want this baby to have breast milk right away, and there is something called breast scroll, which we have made a video. So you give that baby while doctor is doing some other work on mother. Baby can easily go on mother's chest, in a breast scroll position, and then can breastfeed. So those babies mothers will definitely get right away breast milk. Second thing is oxytocin. If mother is stressed, if mother is in pain, if mother has anxiety, if somebody is bothering mother, even if she's making breast milk, that she will not have a letdown reflex, that milk will not release. So that release hormone is very important. So that oxytocin is also called love hormone. So you make sure that those mothers are in a good mood. When you're in love, you're in good mood, right? So you make sure that you create that good, happy environment around her to increase the supply. So when mother is breastfeeding, it's the whole family which matters, not just mother. So it's important that counseling is really important, to keep that environment happy. Okay. Some pure vegetarians are not convinced by eating, and what is the other alternative? Thank you, Shobna, for asking these questions. I think dairy could be dairy. So I prefer dahi, curd, paneer is good. Beans are really good. Whole beans, but sprouted, cook it. Millets, I like millets a lot. So I prefer, any ancient millets are good. Jawar bajra, okay, but I prefer barnyard, kodri, kodo, lot of those other millets. So, there are little millet, kodo millet, barnyard, proso, right? Ragi is good. So I prefer those millets. Quinoa, if you have access to quinoa, is good. Nuts and seeds, that's my favorite. So for small children, what we have done, we have made powders. We made powders of nut, I'm talking about legume or peanut, and then we have made powder of sesame seed. then put that powder in baby's khichdi, or put that powder in whatever child is eating. So at least child will get all this, your type 2 micronutrient, right? And those type 2 nutrients, someday maybe I can take a lecture on what food which can give you high type 2 nutrient. Okay, so those are main, basically I work a lot on protein. So if you can basically think of all the food which is high in protein, even a vegetarian, children do well. Okay, thank you, Papa. Roma, mother can have sugar substitutes such as sucralose. Roma, I'm not a sugar person for mothers. Okay, because sugar, if you look at it, it is basically, of course, one thing is your glucose and your fructose, but even if sucralose, what you're doing is basically, sugar causes addiction. It's a sweet taste, and there is a whole science to it, right? Because basically brain kind of stimulates dopamine, and you want to have the sweet taste over and over again. So I prefer that you don't want that addiction, because if you're having a chai ka addiction, it's not chai ka addiction, it's a sugar ka addiction you have, because you're having that sugar, that's what you're craving for it, right? So I prefer that to get rid of that addiction, I prefer that let her enjoy this natural sweetness of doodh, because when you have a full fat doodh, it has so sweet. So let her enjoy the sweetness of real natural food, which is not high in sugar. Okay, so even for fruit, I recommend just maybe one fruit a day, maybe after dinner or lunch, not before, or not on empty stomach, so that it gets absorbed slowly. Because anytime when you have sugar, when you put it in the mouth, your body doesn't know where is that fructose coming from, whether it's coming from sugar, whether it's coming from where, right? So try to have food which have a savory food. Okay, all right. Thank you. I think okay, I think we are done. We don't have any. I would really like to thank Krishnendu. Really, I'm so glad that you gave me this opportunity, and let me know how I can be of any help. And please go ahead and kind of subscribe to our channel, so you'll learn a lot of what I spoke about. This is a 5-day training. 12 hours a day, right? 60 hours actually. So I have covered a lot, but I've just kind of touched based upon few points. Okay, so thank you all, thank you for listening.